Okay, what's new for Obamacare in 2013? If you get Obamacare, how much will you pay and who qualifies for subsidized insurance? Many have no idea of how much their insurance tab would run. The federal government, with Obamacare, has basically created a top shelf, middle shelf, and lower shelf of healthcare divisions that did not otherwise exist across the nation before the law. The cost of Obamacare plans depends upon the quality of plan you choose to purchase. You get what you pay for. Today, I'll be informing you and helping you to better understand the pros and cons of Obamacare and where our country is headed. With this new law, I am credited to speak on behalf of the topic since I have done extensive research and understand the subject clearly as a recent topic of controversy in the United States. I will be doing this by feeding you knowledge of the pros and cons of Obamacare that include uninsured Americans will have available and affordable insurance. Americans cannot be dropped from their insurance, nor can they be turned away. In any business, over the equivalent of 50 full-time employees must provide health coverage, and taxes will increase. Many Americans do not have adequate means of receiving health insurance, but with Obamacare, insurance will not only be effortless to get, but will also be more cost-effective for those who cannot afford it. The act was designed to reduce overall health care costs by making services available to the 32 million who currently can't get insurance. They often use hospital emergency rooms as their care physicians, as stated by Kimberly Amadio in the About.com guide. Access to health care. The increased access to health care is expansion on existing plans. For example, Medicaid will now include low-income adults without children who previously were not on the plan. Also, anyone under the age of 65 with an income of less than 138% of the federal poverty level, $15,856 for an individual, and $32,499 for a family of 4 will be covered. Obamacare provides improved preventative and wellness services with no out-of-pocket costs and reforms aspects of Medicare to improve overall care for seniors. Patients' care under Medicare will improve as pilot programs to improve. Efficiencies are implemented, and doctors and hospitals are encouraged to coordinate care through payments incentives. For the first time, Medicare will be given to those doctors and hospitals that provide good quality care. This was talked about in the ARA of Alliances for Retired Americans. Obamacare has changed the mindset of hospitals from now on. The access to individuals who receive these benefits that they did not have before. It's now about quality, not quantity. Over 32 million U.S. citizens are completely without health insurance, said by Katie Austin, New York Times, in her article promoting Obamacare. The Obamacare Act is making plans more affordable by expanding Medicaid up to 15.9 million men, women, and children below 138% of the poverty level, according to an article I read, Obamacare Healthcare Laws. Through further reading on NAS.com, I found that Obamacare has asked insurance companies to give better coverage at a lower rate in exchange for 30 million more customers. These are just a few ways Obamacare has helped uninsured Americans get affordable insurance. Millions of disabled, ill, and low-income individuals are turned away from insurance companies. Americans now can't be dropped or turned away from insurance companies. Individuals with pre-existing medical conditions are protected by the Obamacare law. James C. Carpetta and Tom Miller discussed the issue, and a quote by them was, "The law's prohibition of pre-existing conditions, exclusions in health insurance, which would prevent insurance companies from denying coverage to customers with serious medical problems." Another plus of not being turned away consists of parents being able to keep their children up to age 26 on their insurance plans, instead of being denied coverage on their plans past 18. Obamacare has it said that for people who can't afford health insurance, the federal government will pay the states to add them to Medicaid. 50 states ACA required states to expand Medicaid coverage to people with incomes up to 138% of the poverty level. In contrary, Obamacare is slowly putting in effect. 2015 businesses with over the equivalent of 50 full-time employees must provide health coverage, says Obamacare Facts Dispelling a Myth. The means or working middle class will either be laid off or their hours will be cut back so they won't have to be provided health insurance. The fact is, we're growing in numbers every day with unemployment. This will only increase that, plus people are going to move to lower classes when they lose their job hours and don't make as much. With Obamacare though, there's an option even though it might not be a beneficial one. Every person in America will have the option to possess insurance, or they will pay a tax. Also, more taxes will be added to aid and healthcare reform. Obamacare Act will have to lower the budget deficit by $143 billion over the next 10 years by raising some taxes, according to an article by Kimberly Amadio. There will be a tax placed on the higher class individuals to help pay for the low class individuals receiving Medicaid and the seniors receiving Medicare, as discussed in Forbes.com. Working class individuals have to pay more for their insurance based on their income on Obamacare, plus they pay taxes to help pay for those who don't make as much or don't work. In closing, this is a controversial topic that has many different pros and cons. Depending on what is most important to you when it comes to healthcare will depend on how you see this topic and what side you sway towards. By feeding you knowledge on the topic of the pros and cons of Obamacare that included uninsured Americans will have available and affordable insurance, Americans cannot be dropped from their insurance company, nor can they be turned away. In any business, over the equivalent of 50 full-time employees must provide health coverage, and taxes will increase. I hope you have a better understanding of the controversial topic of Obamacare. Now the question is, are you getting what you pay for with Obamacare?